Hello, everyone. Good evening for all of you. Let's start today the fourth revision for the KAPS exam, for the coming KAPS exam. As usual, I will make all of you mute. And if you have any question, please open the mic and ask about it. And at the end, we will open the discussion so you can ask what you need. You can ask about what you need at the end. Okay? We will discuss about 25 questions today from the previous exams. Either from paper 1 or paper 2. So let's start to see the questions today's session. The first one is the first question. Which one is not caused by decreasing dopamine and increase in acetylcholine? Here, what is the condition that we discuss? Decreasing of dopamine and increasing of acetylcholine means there is a Parkinson's disorder. So let us see the choices: ataxia, hyperreflexia, rigidity, or bradykinesia. Here he asks about which is not. So, which is not a symptom of Parkinson's. Regarding to those choices, hyperreflexia is not typically caused by decreasing dopamine and increasing acetylcholine. It is more commonly associated with an exaggerated reflex response in the presence of upper motor neuron dysfunction. Okay? Symptoms such as ataxia, rigidity, bradykinesia are commonly seen in condition involving dopamine depletion, or what we call it Parkinson's disease. The next question. An example of transporter protein which are embedded in the lipid bilayer of cell membrane is P-glycoprotein, cytochrome P450, adenosine triphosphate, or alanine. Yes, we are talking about a transporter protein that help in transport or diffusion of substances. Okay. Here, the P-glycoprotein is the right answer. It will prevent the transportation. So the substances that are substrate to P-glycoprotein, this P-glycoprotein will affect their absorption through membranes. An example of this is digoxin. Digoxin affected by P-glycoprotein. So if we have another drug like amiodarone, what will happen? Amiodarone is P-glycoprotein inhibitor. So it will inhibit the P-glycoprotein so that the diffusion and absorption of digoxin will increase, leading to a toxicity from digoxin. Okay. The next question. What is the first line therapy for Lyme disease? Is it ciprofloxacin, azithromycin, erythromycin, doxycycline? The answer is doxycycline. Doxycycline is considered as the first line treatment for most cases of Lyme disease, which caused by which type of bacteria? The bacteria here called Borrelia burgdorferi. Some questions of some of the previous exams asking about what is the causative organism of Lyme disease. It is Borrelia burgdorferi. The next one. Usually used as a diagnostic test in active TB. Take care here because we are talking about active TB. What are the tests that used to check if TB present or not? We have several tests, either blood test, skin test, which we call the tuberculosis test, or Mantox test, chest X-ray, sputum test. All of those tests can be used for check the presence of TB. But TB may be active or latent. Okay? It is either active or latent TB. For active TB, we need to check the chest itself.
لا لا
لا
ما مسجل كان.
Please, mute your mic to avoid any interruption. I'll make all of you mute. Okay. So again, the active TB means that the TB causing a problem in the chest, in the lung. So one of the tests that's used to check the active TB is the chest X-ray plus Newton test. Both are used to check the active TB. While latent TB means that there is the antigen of the TB present in the blood, but not active. And it may be active at any time. So other tests can be used to check the latent TB. Okay, let us see the choices here. We have tuberculin mantox test or skin test, chest X-ray, nucleic acid amplification test, and TB skin test. All of them will check the presence of TB. Why?
فوقيهم.
Have a question?
Last one.
Make your mic mute. Don't open your mic, please, to avoid any interruption. Okay? PCR, yes, can be used. PCR is a nucleic acid amplification test. Okay? But it will check the TB, but not differentiate is it active or latent. Okay? The active test, we have two tests to check the active TB, either chest X-ray or sputum test. So the right answer here is chest X-ray. Which of the following opioids is least likely to cause serotonin syndrome? As you know, the opioids plus tramadol will increase serotonin level. So if they administered with any of the MAO inhibitors or SSRIs or SNRIs may lead to serotonin syndrome. Serotonin syndrome is a potentially life-threatening condition that occurs when two or more than two serotonin enhancers used at the same time. It can be caused by medication, drugs, or supplements that increase serotonin level or activity either alone or in combination. Some of the opioids can cause serotonin syndrome are those that have serotonergic properties, such as inhibiting serotonin reuptake and increasing serotonin release. Includes tramadol, meperidine, methadone, dextromethorphan. Okay. Other opioids that can cause serotonin syndrome are these that interact with other serotonergic medication, like antidepressants, migraine medications. Okay. So let us see the choices and choose the right answer here. Morphine, tramadol, fentanyl, and methadone. We are looking for the least one. Morphine is the right answer. Morphine is the least likely to cause serotonin syndrome among all options that are present. Okay. The next one. Arrange higher elemental iron to low elemental iron supplements. Here we have different sources of iron. Which of them contain higher percentage of elemental iron? To see the different orders and choose the right order. Ferrous fumarate, then dried ferrous sulfate, and ferrous gluconate. Or gluconate, then sulfate, then fumarate. Or sulfate, then dried sulfate, then gluconate, then fumarate. Or sulfate, then dried sulfate, then fumarate, then gluconate. As you know, the highest elemental iron present in ferrous fumarate. Okay? Ferrous fumarate is the highest one that contains elemental iron, about 33%. About 33%. So the right answer here is A. Let us see the content of iron in each salt. Ferrous fumarate here, elemental iron about 108. It is about the third of the quantity. So it is about 33%. While sulfate, we have sulfate and dried sulfate. Generally, both of them may contain a range of 26%. Okay, or less than that. Gluconate is the lowest one, which contains from 11 to 12% of elemental iron. Okay, which is the order of elemental iron in different salts of iron. The next one. Which of the following all close contact should be treated? So if the person infected with this condition, which of them all close contact should be treated? Head lice, scabs, head lice and scabs, scabs and pinworm. What is the right answer here? Yes, it is D. Why D? For head lice, all close contact should be examined, not treated. Who of them should be treated? The infected person, firstly, and the person who share the items with the infected person only, while other household members should not be treated. On the other hand, for scabs, all should be treated, either infected or not. Also for pinworm, all should be treated, either infected or not. Okay, so that the right answer here is D. The next one. Which of the following is not a correct match? Let us see. Here we should focus on some points regarding to hyperparathyroidism and hypoparathyroidism and the relation with calcium and phosphate. We will explain it. I will explain it now. Let us see the choices and choose the right answer firstly, then we explain it. Hypoparathyroidism cause hypocalcemia. Hypoparathyroidism cause hyperphosphatemia. Hyperparathyroidism cause hypercalcemia. Hyperparathyroidism cause deficiency of calcium, which is not. This is the wrong statement, and we should use this. Let us understand this very well. Firstly, what is the role of parathyroid hormone? Parathyroid hormone, like vitamin D, both having the same action. They do three things. All of them, at the end, increase in calcium level in the blood. Parathyroid will increase calcium absorption from the GIT. Increase calcium reabsorption from what? From the kidney. Increase calcium resorption from the bowels. As a result, calcium level will increase in the blood. Okay, so the end result of parathyroid hormone or vitamin D is increasing of calcium level in the blood. What will happen when there is an increase in calcium? Calcium is opposite to phosphate. It will form a chelation with phosphate ions, so that phosphate ions will decrease. As calcium increase, phosphate will decrease. There will be a case of hypophosphatemia and vice versa. As phosphate increase, calcium will decrease. Okay? Don't forget this relationship. What is the relation between calcium and parathyroid gland? Calcium, there is a receptors or a sensors in the parathyroid gland feeling the level of calcium. If there is a low calcium level in the blood, leading to stimulation of parathyroid gland to increase parathyroid hormone release. This parathyroid hormone release leading to what? Parathyroid hormone leading to increase calcium level to compensate this decrease. The increase of calcium leading to what? A decrease in phosphate level. Okay? If we have a case of hypophosphatemia, so firstly, the hypophosphatemia happens due to several causes. One of them is the kidney impairment or acute renal failure or chronic kidney disease. Okay? Hypophosphatemia means a low phosphate level leading to hypercalcemia. I'm sorry. The acute renal failure or chronic kidney disease leading to hyperphosphatemia. In acute renal failure or chronic kidney disease, CKD, chronic kidney disease. Okay, in acute renal failure and chronic kidney disease, there is a high level of phosphate in the blood. This high level of phosphate in the blood leading to low calcium level. This low calcium level leading to stimulation of parathyroid gland to increase parathyroid hormone. And this parathyroid hormone will increase calcium level in the blood, which leads to a decrease in phosphate level. Okay? Don't forget those relationships. If you don't understand anything or having a problem with anything regarding to this point, please ask about it. Okay, let's see the next one. Phil Graston is used to. What is the Phil Graston? Phil Graston is a colony stimulating factor. I have a question in the chat here saying that what is the condition cause hypophosphatemia? Hypophosphatemia may happen due to increasing calcium level. If we have a case of hypercalcemia, we have a case of hypophosphatemia. Okay. Let us go again to the question number 9. Filgrastim. Filgrastim is one of the colony stimulating factor. What is its function? It will increase synthesis of neutrophils. So we use it as a therapeutic drug, or the therapeutic use of it is in cases of neutropenia. If there is a decrease in the neutrophils. What are the conditions that leads to neutropenia? One of them is the destroyment of the immune system. Another case when there is a chemotherapy indications. Chemotherapy will lead to bone marrow depression, so that decreasing the synthesis of white blood cells, and one of the white blood cells is the neutrophils. Okay, in case of cancer, yes. In case of chronic kidney disease, not actually chronic kidney disease, but the case of infections. Okay. So here, Phil Graston used in many indications in the patient receiving immunotherapy or chemotherapy. The patient receiving immunotherapy or the patient receiving chemotherapy. Both of them leading to decrease in the neutrophils. When the patient receiving immunotherapy, the immune system will be destroyed so that it will be susceptible or there is an infection or any infection can attack the body very easily. Let us see the choices and then choose the right answer. Reduce the risk of urinary tract infection or reduce the risk of peripheral neuropathy or reduce the risk of cardiac toxicity or reduce the risk of hemorrhagic cystitis. The right answer here is to reduce the risk of urinary tract infection. What is the relation? As I mentioned, when the patient receiving either immunosuppressant agents or chemotherapeutic agents, they will destroy the bone marrow or decreasing the neutrophils count so that the patient here may have any bacterial or viral or any pathogenic infection. To protect of him against these infections, we should give Phil Graston to increase the neutrophils count. So the right answer is the reduction of urinary tract infection to protect against urinary tract infections. Let me ask something. What we call the lowest level of neutrophils after chemotherapy administration. What is the term of this?
Nadir.
Yes, it's called nadir. Okay, it's called nadir, and this is one of the questions of the last exam. One of the questions of the last exam. What is the nadir? Nadir is the lowest level of neutrophils after chemotherapy administration. When we reach this level, we should give colony stimulating factor like filgrastim or salvinolustim or let's like this. Let us see the next one. What would be the loading dose for a drug if desired peak concentration is 20 microgram per milliliter and steady state plasma concentration if the apparent volume of distribution is 4.5? Here we are looking for the loading dose. Okay, it is one of the pharmacokinetic calculation problems. We need to know the formula that we use. What is the formula? The formula saying that loading dose equal plasma concentration or steady state concentration multiplied by VD. Okay, we have the steady state concentration CSS equal 20 microgram per ml and volume of distribution equal 4.5 liter. We cannot use those figures directly. We cannot multiply 20 by 4.5. We get a wrong answer. Why? Because we should check the units and make the units compatible with each other before we start the calculation. Here, the unit of the weight by milligram should be by milligram. So we should convert this 20 microgram into milligram. How? By multiplication with 10 to the power minus 3. 20 multiplied by 10 to the power minus 3 milligram per ml. Also, the unit of the volume is not right. liter, we should convert it into milliliter. So it will be 4.5 multiplied by 10 to the power 3 ml. Now we can multiply 20 multiplied by 4.5. Here, the right answer will be 90 milligrams. Okay, this is how can we solve a question like this. Rhizofolvin 50 grams added to glycerin 20 milliliter. Take care about this one. Is a tricky one and repeated with the same figures in some of the previous exams. Rhizofolvin 50 grams added to glycerin 20 milliliter to form a paste. The density of glycerin is 1.25. What is the unit? Gram per milliliter. Gram per ml. This is the unit of the density of glycerin. The final concentration of rhizofolvin in this paste. How can we solve this one? Okay. We add 50 grams to 20 ml. Firstly, we should know what is the weight of this 20 ml. How can we know that? By using the density, each 1.25 gram represent 1 ml. We have 20 ml, so how many grams of glycerin in this case? 20 multiplied by 1.25 equal 25 grams. Okay, so now we have a paste formed of two parts. 50 grams of rhizofolvin and 25 grams of glycerin. Okay. What is the final weight of this paste? $75 grams, right? It is 75 grams. What is the final concentration of rhizofolvin in this paste? How can we solve it? It is a 50 grams of rhizofolvin present in 75 grams of the paste. So what is the percentage in this case? 100 grams containing how many rhizofolvin? You should multiply 100 by 50 over 75 will be 66.7. Is it okay for all of you? Or do you have any confusion about this calculation? As you see, they are very easy one, but having as a little trick. So you should know this trick. The next one. A 3-year-old boy diagnosed having otitis media has been prescribed amoxicillin suspension at a dose of 90 milligrams per kg for 5 days. Okay. His weight is 36 pounds. If the product in the pharmacy is 250 milligrams every 5 milliliters, and the doctor is instructed to give 3 divided doses, how many milliliters is the total volume required? This is the daily dose for amoxicillin, 90 milligrams per kg. Firstly, we need to know how many milligrams per day should this child receive. How? By multiplying 90 by the weight of the patient. Weight here is 36 pounds over 2.2 to get it by kilograms by 5 days. Okay, so 90 multiplied by 36 over 2.2 by multiplied by 5. Okay, 90 multiplied by 36. over 2.2 multiplied by 5. The total milligrams received in these 5 days is 7,364 milligrams. Every 250 milligrams present in a 5 ml. So what is the total volume? 7,364 multiplied by 5 over 250. It would be approximately 150 milliliters of the bottle. Okay? Sometimes in some of the questions, the weight by pound, not by kg. So do you know how can you convert from the pound to kg or from kg to pound? Every 1 kilograms equal 2.2 pounds. So if you want to convert from pound to kilogram, you should divide by 2.2. Okay? The right answer here is 150 milliliter of this water. To prepare a solution of 25 millimole per liter of sodium chloride, how many grams of sodium chloride should be used for 1 liter solution? Okay, here we have 25 millimoles per 1 liter. We need to calculate the weight of sodium chloride used for this 1 liter. How can we solve? Just by using the formula of millimoles equal the weight by milligram over the molecular weight. Then we can get the weight equal the millimoles, which is 25, multiplied by the molecular weight, which is 58.5. So the right answer here is 1.46. Which of the following is a reason why ticagrelor is preferred over carbapenem? Is it due to ticagrelor has a broader antimicrobial coverage, or has a lower risk of allergic reaction, or has a longer half-life, or has an incidence of gastrointestinal side effects? The right answer is ticagrelor has a broader antimicrobial coverage over carbapenem. It exhibits a wider spectrum of activity compared to carbapenem. It is effective against both gram-negative and gram-positive bacteria, including Pseudomonas, while carbapenem, on the other hand, has a limited activity against gram-negative organisms and mainly used against gram-positive bacteria. I'll repeat any question at the end. If you want to see any of other questions again, at the end we will do that. Okay? Let us see this one. Which of the following cytochrome enzyme actions is incorrect? So we have some matches. What is the incorrect match? Smoking is a cytochrome 1A2 inducer. Is it right or wrong? Right statement. Tamoxifen is a cytochrome 2D6 substrate. Is it right or wrong?
Right, sir.
Right.
Right. Can you give me another example of a substrate of cytochrome 2D6? 2d6.
Codeine.
Another example is codeine. Okay. Clopidogrel is a substrate to cytochrome 2C19. Is it right or wrong?
Yes, sir. Right.
St. John's wort is a cytochrome 3A4 inducer. Is it right or wrong?
Right.
Right. So the answer here is E. Let us see. Clarithromycin is a substrate to cytochrome 3A4. Is a wrong statement. What is the right statement of this?
There is an inhibitor.
Yes. If you replace this substrate by the word inhibitor, then it will be a right answer or a right statement. Ciprofloxacin should not be given with which of the following drugs or substances? Antacids contain aluminum or magnesium, proton pump inhibitors, calcium supplements, or vitamin C or ascorbic acid. So we should avoid the administration of ciprofloxacin with antacids containing aluminum or magnesium first. The calcium supplements here have an interaction with tetracycline mostly, with a little with ciprofloxacin. So the first answer here should be antacids containing aluminum or magnesium with ciprofloxacin. Which of the following medications is known to cause hypokalemia as a side effect? Let's see. Acetaminophen, ibuprofen, hydrochlorothiazide, or omeprazole. First is hydrochlorothiazide. Thiazide will lead to hypokalemia or depletion of potassium. What is the main side effect of omeprazole regarding to the electrolytes? The long-term use of PPIs leading to
hypomagnesemia.
Yes, hypomagnesemia. A low level of magnesium. Which is not correct about vasopressin. What is the vasopressin? It is the antidiuretic hormone, which is secreted from which part of the body?
Posterior pituitary.
Yes, posterior pituitary. Let us see the choices. Deficiency cause diabetes insipidus, or action enhanced by alcohol, or constrict the blood vessels, or increase water reabsorption. Here we are looking for the wrong statement, which is not correct. A deficiency will cause diabetes insipidus. Yes, this is a right statement. It will lead to constriction of the blood vessels, vasoconstriction. Also, yes. It will increase the water reabsorption, so decreasing the urination. This is one of the action of the vasopressin. So the action enhanced by alcohol, this is a wrong statement here. The alcohol consumption can increase the urine production, leading to more frequent urination and potential increase in the fluid loss of the body. And this effect often referred to as alcohol-induced diuresis. When counseling a patient about proton pump inhibitor, which of the following statements is correct? PPI may cause hypermagnesemia. We just mentioned that PPI will lead to hypomagnesemia. PPI should be taken before trying a histamine blocker. No, it is taken in the severe cases, so we can start with the histamine blocker or H2 blockers before PPIs. PPI may cause hypomagnesemia. This is the right statement. PPI should not be taken with antacid is a wrong statement. It may be used, but we should make a separation between doses. In which scenario is atenolol commonly used? Let us see the choices or scenarios. In moderate cases of heart failure, or after the loading dose of digoxin, or after achieving normal digoxin level and monitor it daily, or after myocardial infarction with hypertension. What is the best therapeutic use of atenolol regarding those choices? Is after myocardial infarction with hypertension. Okay. In a heart failure, it is not recommended as the first line. In a heart failure, carvedilol is the recommended beta blocker. After a loading dose of digoxin, you should not combine digoxin with beta blocker or calcium channel blocker. In this case, you may have a heart block. After achieving a normal level of digoxin and monitor daily, it can be used, but here it is not a commonly. So the best answer is the 4 for the after myocardial infarction with the patient having a hypertension. The interaction between aripiprazole plus diltiazem. What is the first thing that you should think about regarding to this interaction? Diltiazem is a calcium channel blocker that have an effect on the enzyme or cytochrome that leads to enzyme inhibitor. It is an enzyme inhibitor. So it may lead to increase in aripiprazole level in the blood, or decreasing its metabolism, or decreasing its clearance. Okay, so now we have the answer. Let's see the choices, and we can choose the right answer. The increasing diltiazem level or increasing aripiprazole level, which is the right answer here. Okay. In the exam, you may have case study. This case study will be the last 4 questions of each paper, either paper 1 or paper 2. Those case studies, just a history of a patient, will give you a story about the patient and the history of his conditions and medications, and ask 4 questions regarding to those conditions or the medication that he used. So let us see this case. Mrs. Smith has recently been diagnosed with hypertension and hypercholesterolemia. She presents to your pharmacy today with a new prescriptions for hydrochlorothiazide and simvastatin. She asks to speak with the pharmacist when she picked up her medication. She asks several questions about her new regimen and inquiries about the lipid-lowering agent. Let us see the questions or the 4 questions regarding to this case. The first one, Ms. Smith has some symptoms of peripheral edema and shortening of her breath with chronic coughing and wheezing. The physician asks you about which of her medication is contraindicated with her newly diagnosed case. The first thing, what is this condition or what is the diagnosis of her? Let's see the symptoms. We have edema, peripheral edema. We have shortness of breath. We have chronic coughing. wheezing. Those 4 symptoms. Yes, you are right. There is a congestive heart failure. Okay, so this patient suffered from congestive heart failure. The 4 choices here, which of them is contraindicated with this condition? Is it simvastatin, losartan, hydrochlorothiazide, or pioglitazone? Of course, now we have the ability to choose. It is pioglitazone. Pioglitazone is contraindicated with any patient having congestive heart failure. Why? Because pioglitazone may lead to edema, and the patient already having an edema, so we should not use this pioglitazone with the patient. Not weight gain due to the edema. The patient suffering from edema already, and pioglitazone has thiazolidinediones, will lead to accumulation of fluids inside the body, which leads to weight gain, and this edema is contraindicated with the patient already having heart failure. Another one, after 2 weeks, Mrs. Smith came to the pharmacy with some skin reactions after she exposed to the sun. At previous weekend, which of her medications is responsible for this effect? Okay, so here we are looking for a drug leads to photoallergic reaction or photosensitivity. Of course, it is hydrochlorothiazide. Another one. All the following are metabolic effect of hydrochlorothiazide except thiazide diuretics will lead to what? 3 hypo and 4 hyper. The 3 hypo are hyponatremia, hypokalemia, hypomagnesemia, while the 4 hyper are hypercalcemia, hyperglycemia, hyperuricemia, hyperlipidemia. Please don't forget this. So let us see the choices. Increase potassium excretion. Is it right or wrong? Yes. By increasing potassium excretion, potassium level will decrease in the blood, leading to hypokalemia. Hyperglycemia. Yes. Hyperuricemia. Hypotriglyceridemia. No, it will lead to hyperlipidemia or hypertriglyceridemia. The last question in this case, and also in today's lecture. The main side effect of simvastatin is, or statin will lead to rhabdomyolysis or myopathy. So the right answer here is rhabdomyolysis. Okay, this was the last question today. Still, have the ability to attend the revision for the coming exam. And the coming lecture will be the most recent course for the last exam. It's one of the most important revision lectures all over our revision. So don't miss this revision. It will be in the coming Tuesday. Okay, so to reserve the revision and to attend the coming one, please join this link, UPTech course exam offer, to attend the coming one, which is the most important one regarding to our revision. And this revision will contain the most recent questions that present in the last KAPS exam. Now we can open the discussion and see what are the questions. The first one here, the question number 13. Sorry, number 13 firstly, then we can ask. Okay. Question number 13. So this one. It is a calculation problem. To prepare a solution of 25 millimoles per liter. How many grams? Okay. we need to calculate it by grams. So after we get the answer, which will be by milligrams, you should convert it into grams. Here we have the formula saying that millimoles equal weight by milligrams over the molecular weight. Just multiply the weight by the molecular weight. Or millimoles by the molecular weight to get the weight by milligrams. Then convert it to grams by dividing by 1,000. Okay. What is your question?
Sir, if patient on statin, what test should be done?
Patient, I'm sorry, again the question.
Sorry, if patient on statins, what test should be done?
C-reactive protein to see the muscle destruction. This is one of the tests.
Like liver enzyme and
This liver enzyme also. Because statins will increase liver enzyme level.
okay. Okay, all good. Thank you.
Question number 22. This one or the next one?
Yes, this one. Thank you.
This one. After 2 weeks of the medication or the administration of the drug. Here, the patient having a skin reaction after exposed to the sun directly here, we are looking for the drug that leads to photosensitivity. Which drug will lead to photosensitivity regarding to those choices? Simvastatin, losartan, hydrochlorothiazide, or pioglitazone is hydrochlorothiazide. Okay.
Yes, thank you.
I have a question here about the differences between substrate and inducers and inhibitors. Let us understand this. If this is the cytochrome or the enzyme, okay, we have 3 options. One is called substrate. The second is called inducer. The third is called inhibitor. Okay, what is the difference between the 3 terms? Substrate means that a drug that metabolized by this enzyme. So the metabolism of this drug needs this cytochrome to be happen. The metabolism needs the cytochrome to be happen or to occur. Okay? What is the inducers? Inducers here increase the activity of the cytochrome. Increase the activity of the cytochrome. What is the inhibitor? Inhibitor will decrease the activity of the cytochrome. This is the difference. What will happen when we give 2 drugs? One of them is a substrate plus inducer. A substrate plus inducer. Inducer will increase the activity of the enzyme so that what will happen? It will metabolize the substrate more effectively and more faster. What is the end result? Decrease the level of substrate. Okay, it will decrease the level of substrate. So you can remember the following. The inducer with D will decrease the level with D. On the other hand, what is the effect of inhibitor? Again, inhibitor will decrease the effectiveness of the enzyme so that the enzyme will not metabolize the substrate by an effective way. What will happen to the substrate? There is an increase of the level of substrate. Okay? So the effect of inducer decrease the level, while the inhibitor increase the level. Is it okay? Is it clear?
Do you have any example of the substrate plus inducer? Any drug?
Substrate plus inducer for any drug. Let us put the following.
Carbamazepine.
Carbamazepine. CBZ. What is the effect on the enzyme? It is
Auto-inducer.
inducer. So if you use it with any drug metabolized by the cytochrome 3/4, an example of drug D, what will happen? It will decrease the level of drug D. Okay, it will decrease the level of drug D. Another question. Here we have a question about what does it mean of mixed agonist antagonist. The word mixed agonist antagonist, what does it mean? If we have a receptor, here this is a receptor, and drug having the ability to bind to this receptor, and we call this drug having mixed agonist antagonist effect. What does this mean? This means that this drug will bind to the receptor as an agonist firstly. Okay? It will do the agonist effect with the receptor. Then, by step by step or gradually block the receptor, giving the antagonist effect. Okay? Like opioids, some of the opioids called mixed agonist antagonists, like buprenorphine. What will happen here? Buprenorphine acting as an agonist in the first attempt, so that giving the agonist effect on the opioid receptors. Then start gradually to decrease this agonist effect by blocking the receptor. So what will happen? It will decrease the withdrawal symptoms. It will decrease the withdrawal symptoms of the opioids. Okay?
Yes, all good, sir. Thank you.
Any other question? By the way, regarding to agonist and antagonist, which having a high or a higher affinity to the receptor? If you have
Antagonist.
two drugs, one of them is agonist and the other is antagonist. One of them is agonist and the other is antagonist. Which of them firstly attached to the receptor? The agonist or the antagonist?
Antagonist.
Antagonist. This competition leads to the antagonist attachment with the receptor, the higher affinity. And when the antagonist level in the blood decrease, the agonist start to attach. Okay. Any other questions?
Sir, what's the dose for the doxycycline for the Lyme disease?
100 milligrams. Okay.
100?
Yes.
Okay, thank you.
Beta blockers with intrinsic sympathomimetic activity can be used in hypertension. Okay, sorry for this late. Beta blockers with intrinsic sympathomimetic activity, yes, they can be used to treat hypertension. Okay. Any other questions? Codeine is more addictive than nicotine. Codeine is more addictive than nicotine. Okay. Finally, I would like to thank you so much about your attendance today. I hope it was useful lecture for all of you. Of course, still we have another revision lecture, which will be in the coming Tuesday, the most recent record. So don't miss this revision. Thank you so much and see you in the coming revision. Goodbye.